Now I will show you how to apply a successful corporal dermal health session. Dermal health is a non-invasive method of continuous vacuum at a constant flow that activates skin tissues and stimulates microcirculation. In this way, it is easier to remove toxins and deposits of excess body fat, and the adipose panniculus is reduced. It contours the body and reduces volume, and it heightens lipolysis in the deepest fat levels.
Unlike other vacuum therapies on the market, this therapy uses a high-revolution axial turbine, 17,500 RPM, and it can reach flows of 35 liters per second and a constant suction of 180 mbar. Such suction and the action of the fixed rollers produce an undulating effect on the tissue and activate microcirculation. This system protects the skin and tissues from damage.
In conventional systems of vacuum therapies that use a pump, tissues suffer from compression and decompression since the pump works at low flow and higher pressures, so tissues are likely to get damaged. In order to control this suction, mobile rollers are used. Thanks to the technology used by Body Health, it is possible to achieve better results in fewer sessions.
The treatment must be applied by highly qualified professionals trained by Body Health to ensure a correct application.
Now, let's see how a successful corporal dermal health session is carried out. Step by step, you will clearly see how to achieve the best results in fewer sessions.
The sessions must be carried out in a room or beauty salon booth of 2 by 3 meters at least. The place must be quiet and well ventilated. If possible, it should be air-conditioned or properly heated. Dim light is ideal.
The session will be carried out in silence so that the patient can relax and the therapist can work efficiently.
The patient wears a lycra leotard with neither seam nor elastic. The leotard has to cover lower and upper limbs completely up to the neck. Patients must not wear underwear. The material must be elastic so that the head can slide smoothly without slipping. Patients with circulatory disorders should wear a white leotard so that circulatory problems can be easily seen. The patient is in a ventral decubitus position with her head to the right of the operator. The therapist stands next to the stretcher, diagonally from the patient, and must cover the patient's body with her right arm. She must semi-flex her knees, contract her abdomen, and relax her arms and shoulders. She will hold the head's handle with her right arm without flexing or extending her wrist, as a bad movement of her wrist might cause tendinitis. Her left hand must be placed on the other side of the head. This hand commands the movements of the head as it does not bear any weight. The equipment is placed behind the therapist in a diagonal position.
The selection of programs depends on the operator's experience.
Beginners should use a manual program with a power of 70% for 35 minutes. An experienced therapist will be able to use the manual program or select the most suitable treatment from the pre-selected programs. An advanced therapist can build up his own programs for each case. The maneuvers. There are 3 different maneuvers as it is necessary to activate the connective tissue and carry out a drainage at the same time. First, lymphatic drainage maneuver. Go down with the head diagonally from the ganglionic point to the distal area. Turn the head 90 degrees and slowly go back to the ganglionic point. Cover all the area to be treated applying the same maneuver. This is the maneuver that will deposit the fat, detritus, and all the lymphatic content in the ganglions. And for this reason, the therapist will always alternate it with a mobilization maneuver, as it would be a big mistake to activate the tissue to be treated without removing it through the lymphatic system. Therefore, the therapist always has to start and finish with a drainage maneuver. The other 2 are connective tissue maneuvers. The objective of these maneuvers is to make a neutral tissue without circulation, non-contractile, stagnant, become active. These maneuvers are butterfly, applied perpendicularly to the drainage maneuver with twists of 90 degrees twice. Then, with the drainage maneuver, go back to the ganglionic point. The area to be treated is covered as from the area close to the distal one. The direction of the maneuver is not so important because the drainage will be carried out later. The butterfly maneuvers are specific for cellulite and localized obesity. The second maneuver is cheaping, The cheaping maneuver consists in applying a kneading movement with the head, detaching it from the back roller without lifting the fore roller. The cheaping maneuvers are used to treat very localized areas of cellulite and localized obesity, for example fat pockets, lower abdomen, etc. The lymphatic drainage maneuvers are used in all cases without exception. In order to apply the maneuvers, no function must be selected. The operator must be in charge.
Now we're ready to start the patient's treatment. Follow the instructions step by step and you will be able to achieve the expected results in a very short time. Remember to follow the instructions in the manual that corresponds to the equipment that is being used, so as to program the machine correctly.
The patient is in a ventral decubitus position with her head to the right of the operator. The therapist will hold the head with her right hand. For each area to be treated, the sequence of maneuvers is the following: lymphatic drainage maneuver, connective tissue maneuver, lymphatic drainage maneuver. In most cases, the following sequence is used: lymphatic drainage maneuver, connective tissue maneuver, butterfly, lymphatic drainage maneuver. In the case of treatments for localized obesity and cellulite in localized areas, the following sequence is used: lymphatic drainage maneuver, connective tissue maneuver, cheaping, lymphatic drainage maneuver. These sequences must be repeated as many times as necessary. It is important to remember that the whole body must be treated. It must be divided into different parts, which will be treated conscientiously and systematically. The area must be totally covered, with no exception. The therapist starts with the paravertebral, contralateral muscles and the back area. This initial position is important so as to allow the ganglionic opening of the dorsum, the armpit, etc., and to allow the drainage of the area as well. In each body segment, the therapist starts with a ganglionic unblockage due to the effect of the vacuum of the head that is placed on the ganglion. The side that is contralateral to the operator must be always treated first, because that is the area on which she exerts pressure first. Then, she rests when she treats the homolateral side. From the sacrum, the therapist moves on to the paravertebral homolateral muscles and the back. The ganglionic part of this area is the paravertebral ganglionic chain. The therapist continues with the contralateral upper limb, in which the ganglionic point is the axillar one, and then she passes on to the homolateral upper limb. The position of the two upper limbs is the following: extension of the forearm at 90 degrees with respect to the body and a flexed arm hanging from the stretcher. The arm and the forearm next to the body with the palms upwards. If the treatment for upper limbs is not needed, use the position of extension of the forearm at 90 degrees and only carry out lymphatic drainage maneuvers.
Now let's pass on to the treatment for lower limbs.
The lower limbs are divided into three areas: the gluteal segment, which goes from the iliac crest up to the gluteal fold. The ganglionic point of this area is the sacrum. The ischiotibial segment, which goes from the subgluteal fold to the popliteal hole, the back part of the knees. The ganglionic point of this area is the middle point of the subgluteal fold. The calves segment, which goes from the popliteal hole to the ankle. The ganglionic point of this area is the popliteal hole. The therapist must start treating the contralateral lower limb. After treating the three segments, the head is maneuvered along the external area of the lower limb through the sacrum to the homolateral lower limb. The same sequences are repeated in the homolateral lower limb. Then, the patient flexes her knee and opens her leg to the contralateral side of the therapist. The segment that will be treated next is the thigh, which goes from the iliac crest to the knee. The ganglionic point is the sacrum. Then, the maneuvers must be applied to the homolateral thigh. The head is maneuvered along the external area of the thigh, passing through the sacrum, and the maneuvers are applied in the homolateral thigh. The patient turns round. She is in a dorsal decubitus position. The patient places her legs in a drainage position. She places her legs on a triangular cushion at the level of the upper third of the calf.
Now, the abdomen segment will be treated, which goes from the costal border to the pubis.
In the case of a patient without a prominent abdomen, the abdomen will be taken as a whole segment that goes from the costal border to the pubis, and the ganglionic point is the sternum area. Once the activity on the abdomen is finished, the next area to be treated is the contralateral lower limb. The segment to be treated is the anterointernal face of the thigh. The ganglionic point is the inguinal one. The head is lifted to continue with the treatment on the homolateral lower limb. The segment to be treated is the anterointernal face of the thigh. The ganglionic point is the inguinal one. The beginning and end of the session have to do with accompanying the patient's lymphatic circuit. In the case of obese patients, the segment of the abdomen to be treated goes from the mammary flange to the pubis. There are 4 ganglionic points for the abdomen: the sternum one, the infraumbilical one below the navel, 2 inguinal ones. In the case of a prominent abdomen, the abdomen will be divided into the following 4 segments: upper abdomen, which goes from the mammary flange to half of the abdomen, lower abdomen, which goes from half of the abdomen to the pubis. The last 2 segments correspond to both halves of the lower abdomen.
In this way, the corporal treatment comes to an end. I am sure that if you follow the instructions step by step, you will be able to give your patients the solutions they are looking for, and the treatment will be a success.